Hi, it's Dr. Landwermeyer. I'm here at Hill Country OB/GYN. I'm here in my Dripping Springs office, and we're just about to go upstairs and meet with Valerie. She works with Kethley Physical Therapy, and she is their pelvic floor physical therapy specialist. We're going to go upstairs and ask her some questions about pelvic floor physical therapy and learn more about that today. So Valerie, I was just curious, how did you originally get interested in pelvic floor physical therapy?
Well, I've been a physical therapist for 19 years. I began my career in an outpatient orthopedic setting soon after I received my Pilates certification. And after having my own 2 kids, I decided that I wanted to further my education in pelvic rehabilitation, and that's really how I began treating.
So certain patient types that I typically send for pelvic floor physical therapy, it's very common for me to send somebody postpartum immediately for pelvic floor physical therapy after they've had a baby, about 6 weeks out. And then sometimes people need pelvic floor physical therapy many years after they've had a baby, and maybe hormonal changes have started to weaken the pelvic floor. In addition, if there's a lot of pelvic pain, that's a patient who may also benefit from pelvic floor physical therapy. And what would a patient expect to happen during that initial evaluation and visit?
Sure. The first visit, you can expect to have a comprehensive evaluation. I would be looking at a patient's posture, spinal and hip mobility, core strength and function, as well as lower extremity strength. An internal assessment of the pelvic floor will also be performed. However, if the patient is pregnant or prefers, an external assessment can be performed instead.
And how many visits typically would you expect a patient to need for
After the
pelvic
first visit, we would determine first how often you would attend physical therapy. Typically, patients attend once or twice weekly, but the total number of visits would be determined by the diagnosis, the complexity and severity of the problem, as well as the compliance with the home exercise program.
In most patients, you have them perform a home exercise program?
Yes, a home exercise program is an integral part of the treatment plan. Home exercise can include therapeutic exercise, core muscular strengthening, flexibility exercises, as well as Pilates-based exercise. Other treatment techniques include manual therapy techniques such as soft tissue mobilization, scar tissue release, trigger point release, and muscle energy techniques when indicated. Education is also another important component to the treatment plan. Patients are educated on their diagnosis, posture, biomechanics, and behavior modification if needed.
So if a patient wanted to see you for pelvic floor physical therapy, how would she go about making that appointment?
Yes, she would just need a referral from her physician, and she could go ahead and just call us here at Kethley Physical Therapy. We have 2 locations. However, pelvic floor patients are only seen in the downtown location in the Arbor Center in Dripping Springs.
All right, thanks for your time.
Okay, thank you very much.